Hi, and welcome to my Community Needs Assessment. My name is Jess Meyer, and this Community Needs Assessment focuses on Wilmington, North Carolina. The purpose of this assessment was to focus upon a need in the community, and Wilmington has a large need for resources with those struggling with addiction and substance abuse. Wilmington, North Carolina is one of the highest ranked cities in the United States for opioid abuse at number 1, with 11.6% of adults engaging in some form of opioid abuse. And a fact from the CDC being that on average 130 Americans die every day of an opioid overdose. With that being said, seeing how substance use and addiction impacts my community, I decided to use this needs assessment to focus on what was needed in the community to better help not only those struggling with addiction and substance use, but those around them as well. If we were to focus on the lack of community resources for those battling substance abuse and addiction, we would be able to not only have a safer community for those struggling with substance abuse and addiction, but also those affected, meaning people's families, their work environments, their neighbors, anyone. And so, with that being said, if we had more long-term inpatient care and more access to providers, there would more likely be less emergency room visits due to crisis and people not being able to be seen by outpatient providers. So this process came about obviously by me picking a topic and defining the need. Then I created a survey, which you'll see in the next slide, which I sent out to providers. And I contacted agencies to introduce the survey, explain and ask them if they'd be interested in interviewing. I conducted the interview between phone interviews, in-person interviews, and also through email. And then I analyzed the data for significant findings and reoccurring themes to see what the providers thought about the needs of this topic as well. I developed 11 questions, all focusing on the services that the agency provided, what they thought the community needed, how they would define substance use and addiction, and in terms of treatment, what they thought Wilmington needed the most. I offered the survey to multiple places, including Coastal Horizons, New Hanover Regional Medical Center COST program, Wilmington Treatment Center, Trillium Health Resources, Pavilion by the Sea, and RI International. Most of these are a dual diagnosis program treatment options, along with outpatient providers, also those facing medical issues as well. The surveys were completed by only 3 of the people that I asked to interview. Coastal Horizons Center, which is a dual diagnosis outpatient provider who also does SAIOP and other treatments. New Hanover Regional Medical Center COST program, I did in person, and then Trillium Health Resources was through email, and they are one of our agencies that funds the programs for people that don't have insurance. So through this, I did the interviews, I analyzed some of the data, well, all of the data rather, by analyzing the answers, grouping them together, looking for words that were frequently used, and then identifying themes and recurring responses to identify themes and see if anyone had any good feedback that meshed together. So through this, I developed some common themes and overall findings. So most everyone that I interviewed found that addiction is an illness and a disease rather than a choice or something of that nature. They all had something in common with working within the population. It was definitely a choice for them. As they grew through their career, they were able to see the impact that substance use has. They all had some sort of agreement as well as to the high level of substance abuse in our area and also, of course, the deficits for growth and the need for more services due to the lack of. Overall findings of each agency interviewed was that treating addiction as a disease is the most important thing. Stigma and education are reasons for the lack of education and stigma in itself, and that the community really does need more resources and services in order to make some headway. Listed on this slide are going to be some recommendations and interventions that I had developed before and after meeting with some of these agencies to do the interview from the survey. But really, a lot of us all were on the same page with the needs and recommendations for intervention. Education was one thing that everyone really agreed on, educating the community on the resources and what addiction and substance use look like, and safety along with that is something that everyone focused on, along with needing more inpatient services that are residential or long-term, and of course safe and affordable housing, and then also vocational rehab and work programs is something that would definitely benefit our community. As far as sharing the findings, I have developed a flyer to provide to all of the agencies that I interviewed, along with people that also focus on the same population. So I plan to do a flyer for them and send this out to emails, bring it into their office, or just offer it straight through the provider. And on this flyer, I would like to add in some resources that are local that people could benefit from if they need the services. While this was difficult in the time period we were given, I really did learn a lot, as there are some effective and non-effective factors, of course. But I did make a lot of new connections with the community. I learned more about the services and resources, not only that are helpful to myself, but to the population I'm working with. And also that the stigma and lack of education really do have a negative impact upon moving forward with this. But I am very grateful that I had the opportunity to do this, and I hope that Wilmington is able to move forward. Thank you so much.